Hi, I'm Mary Sefchak, owner of Philomena Birth, and I want to talk to you today about the Lamaze 6 Healthy Birth Practices. I'm a Lamaze childbirth educator who started teaching in the hospital system and then opened up my own childbirth education center and doula agency here in New Jersey. And the foundation of what I teach, the foundation of our practice, all centers around the Lamaze 6 Healthy Birth Practices. These are really super simple, easy to understand tools that any woman can apply to their birth plan to have an empowered and informed birth experience. So let me walk you through them. The first healthy birth practice is let labor start on its own unless there's a clear medical indication for an induction. It's so important. Today we are seeing more and more inductions. And to be honest, they're not all necessary. I'm just going to say it. Some of them are. There are absolutely really valid, really important reasons to get induced. However, an elective induction can more readily lead to a cesarean birth, can lead to a birth where moms don't feel like they have agency over what is happening in the birth experience, and ultimately leads to a birth that is more medicalized. So our first healthy birth practice, which often leads to better outcomes for mom and baby, is let labor start on its own unless there's a clear medical indication for an induction. Our second healthy birth practice, which is honestly one of my favorites, is walk, move around, change positions in labor. This is so important. This is the hill I will die on as an educator. Birth is supposed to be active, and with or without an epidural, you should be changing positions. Before an epidural is in place, you can be standing, walking, slow dancing, swaying, sitting on a ball. I recommend changing positions at least every 45 minutes in labor. Once an epidural is in place, movement is still important. I hope you realize that. However, you cannot get out of the bed, but there are still a ton of positions you can do with the help of your nurse, with the help of your care team in the bed, and use a peanut ball. Pro tip, most hospitals have peanut balls. Find out ahead of time if yours does. If it doesn't, bring one with you. And using a peanut ball in labor with an epidural can keep your pelvis open and allow baby to descend and labor to continue to progress. So move, change positions, walk in labor. Third healthy birth practice is bring really good support with you. Bring a loved one or a partner or a doula with you. This changes everything. I mean, I think about it just in life in general. Good support changes outcomes, and we see that in the labor room as well. Bring people who are going to help you feel safe, help you feel informed the entire time, and help you feel supported. Doulas, I own a doula agency. I myself am a doula, are so skilled in this way. We are trained, we have the experience to be advocates for our clients in the room, to help with natural pain management, to make sure moms and clients are feeling informed the entire time, to make sure, honestly, that the other support people, whether it's a partner, whether it's a friend or loved one there with the mom, knows how to support that mom in a really good way. Bring good support with you. Our fourth healthy birth practice is avoid medical interventions that are not necessary. Ooh, this is a tricky one, right? Because it's hard to know sometimes, is this necessary or is this not necessary? There's a quick little acronym. I did a whole video on it called the BRAIN acronym, which is a really good tool to help you make informed decisions. I'll go through it real quick right now. Make sure if your doctor walks into the room, you know the benefit of what they're suggesting, the risks, the alternatives. Check in with your own intuition, what you think next best steps are, and then N is not now, maybe later. Maybe you can pause for a moment, not rush into a medical intervention, and then if you need it later on, lean into it then. Also, of course, I think this, but taking really good childbirth education beforehand, evidence-based, so that you and your partner feel really confident and informed before you get in the labor room is so important for making informed decisions. Our next healthy birth practice is push in an upright position. Again, a hill I will die on. It is so important. I'm going to do a whole video on this healthy birth practice as well. But traditionally in the movies, honestly, traditionally at most hospital births, we see moms laying flat on their back, holding their legs up. Maybe their legs are even in stirrups and they're pushing in that way. And to be honest, this is not the most effective way to move our babies. We're working against gravity in this position. We're working against the anatomy of our bodies. The shape of the pelvis doesn't create as much space to allow our babies to descend when we are flat on our back. And not only that, women themselves should have options and choices around what positions they want to push in and what feels strongest and best in their body. So we always talk about pushing in an upright position. And I want to say that is an option both with or without an epidural. It's harder to get into certain positions with an epidural in place, but you can absolutely have a variety of positions away from just being flat on your back, whether it's pushing on one side, pushing on the other side. Variation is really important if you're having a prolonged pushing stage. And then our last healthy birth practice is keep mom and baby together, okay? This just seems like common sense, right? But many years ago, the World Health Organization did a huge study, went around the world and asked the question, why are breastfeeding success rates going down worldwide? And what they realized was in most birthing settings in a hospital, the babies were being taken from the moms and not being left with mom. And because of that, of course, our breastfeeding success rates were going down. So it's really important that as long as you're healthy and baby's healthy, baby is placed immediately on your chest and you get at least 1 to 2 hours of skin-to-skin contact. This is so important if you're choosing to breastfeed, but just so important for baby's transition from life inside the womb to life outside. And so important for that bonding that can happen. It's okay if you don't feel immediately connected to your baby, but to have them on your chest at that moment is honestly, for most women, going to regulate your nervous system, regulate baby's nervous system, and really make that connection that's going to be there forever. Those are the Lamaze 6 healthy birth practices. I think they're kind of no-brainers. They're super straightforward. That's why I really like them. I feel like you can apply them to every birth plan, whether you're choosing to birth at home or the hospital, choosing to get an epidural or avoid one. Always come back to these 6 healthy birth practices. They truly, truly create best outcomes for mom and baby.